So today we're going to focus on advocacy made simple, where to begin, and a little bit about our chapter's mission. The chapter is dedicated to advancing the specialty of internal medicine in New York State through education, advocacy, and quality improvement and patient safety. And the advocacy and legislative work that gets done through the chapter goes and gets handled primarily through the Health and Public Policy Committee, which is chaired by Dr. Kellen King, and our vice chair, Dr. Nandini Anandu, who we'll hear from a little bit later. And for those that I'm sure you all know me, the executive director, but what you may not know about me is that I am also a New York State registered lobbyist. A little bit about the structure and organization of the New York chapter. So we refer to ourselves as the chapter, but we do have a C3 and a C6 organization. And our C3 organization does allow for a little bit of advocacy work. But since we do more than a little bit of advocacy, it was important for us to form and to take on a C6 organization. And that's where the work of our Health and Public Policy Committee comes in. It does allow for much more advocacy work and lobbying work. And a little bit more about our Health and Public Policy Committee, which we refer to as our HPPC. As indicated earlier, it is chaired by Dr. Kellen King. It is one of the chapter's largest committees with over 50 members. The committee meets both in the spring and in the fall. It also will meet in between if necessary. And of course, we meet back and forth via email when necessary as well. The committee works to plan its annual advocacy day, its advocacy week. It drafts the annual legislative agenda for the council board to review and approve. It also addresses legislative priorities that pertain to internal medicine and primary care. It monitors legislative bills and other issues. And it also reviews and takes action on resolutions that come into the chapter from members and chapter leaders. And with regard to legislative bills, I just wanted to point out that in New York State, there are over 15,000 bills that get introduced each year into the legislature for action, potential action. Out of those 15 plus bills, New York ACP monitors over 300 of those bills, and about 30 of them are priority bills for us, with even top priority bills looked at even more closely and more frequently. For those of you that don't know or may not know who your state assembly member is, or may not know who your senator might be, our New York ACP website has the ability to find that information for you very quickly. So at the bottom of your screen, there's a web address that you can utilize to obtain that information. We also have a Grassroots Action Center, which can provide you with a lot of information as well. Again, all of this is housed on our website. and it's easily accessible. And as I mentioned earlier, a little bit about our Advocacy Day, our Advocacy Week, that actually is taking place now. Advocacy Day took place this past Wednesday in Albany, and Advocacy Week has been ongoing since this past Monday. There have been activities all week long. I want to thank those of you who participated in those various activities. And also ACP held their leadership day the end of April, on April 28th and 29th in Washington, D.C. And New York ACP did have a delegation that went to D.C. to participate. So a lot of important issues were discussed in Albany on Wednesday, and also when our delegation went to Washington, D.C., ACP had some top priorities that were addressed with our congressional leaders there as well. Now let's talk a little bit about lobbying goals, because that is why we're here today. So if you have an issue or an interest in the advocacy process, then you need to get involved. And creating and building a relationship is really important. And so how do you do that? So one way is to schedule a meeting, either in person or virtually, with your local New York State Assembly representative, your Senate representative, or even your congressional representatives. You can attend local events when possible. And, you know, when you attend those local events, you'll get to meet people, you can introduce yourself, you can have a brief conversation with them. And other ways is to participate, like many of you did with our activities this week. If you're interested in the future in participating in our annual Advocacy Day or ACP's annual Leadership Day, let us know. Or if you're interested in all of the above, that's great. We'd love to get you more involved. And so you definitely want to become an important and a valuable resource for your elected officials. And why do you want to do that? Because you are the medical expert. You have the ability to influence change for better quality and healthcare delivery for all New Yorkers. So let's take a look at how you can do that, and how you can arrange for legislative meetings. And so there are actually 3 stages to a legislative meeting. And we're going to discuss all 3 of those stages. There's the before the meeting and what to do. There's during the meeting, what to do and what not to do. And then there's what to do after the meeting. So before the meeting, you want to select a date, a time, and a format. The first 2 are obvious. The second one, format, is really just, do you want to have a meeting in person, or do you want to have a virtual meeting? And years ago, like pre-COVID, it was really in-person meeting was the obvious choice. But since COVID, virtual meetings have become very, very popular. They've pretty much become pretty normal these days. And even the chapter, before this year, we had our annual Legislative Advocacy Day in a virtual format. And then scheduling legislator appointments can be done by either calling or emailing. Sometimes both are required, because a lot of the office want to obtain as much information ahead of time as possible before they will provide an appointment to you. So what information is requested? So what you want to do is when you call for an appointment or send an email, you'll want to identify yourself. You'll want to indicate your name. You definitely will want to identify yourself as a physician. You will want to identify yourself as a constituent in that legislator's district. Very important. You will get an appointment much faster if you identify yourself as a constituent. You'll also want to include the purpose or the issue for the meeting that you're requesting. And you'll want to also include who will be attending that meeting. Will it be just you, or will it be others that will accompany you to that meeting? Also, before the meeting, you'll want to be organized. So select no more than 2 or 3 priority issues for discussion. If you have just one, then that's not going to be a problem. Also, be realistic. Plan for a 15 to 20-minute appointment. Anything else, anything longer will be a bonus. Also, know the issue, develop the talking points, and have background materials with you. You'll want to prepare some leave behind materials and make sure you include your business card. Important, you will want to know what your ask is. Very, very important. Then for a group meeting, you'll want to conduct a group briefing. You'll want to appoint a group leader and be organized for that appointment. So prepare yourself in advance. Do your homework. Review the bio of the legislator that you're meeting with. What you'll want to do is look for commonalities. You'll want to look for geographic and demographic information. You'll want to look at what committees does that legislator participate on. Again, is it the health committee? Is it the insurance committee? Is it some other committee that might align with the topic or the issue that you're going to be discussing? Again, these are important items that will impact your appointment. Also, look for bill sponsorship and co-sponsorship, two other important aspects. If meeting independently, consider consulting New York ACP or ACP in advance for information on their position on this topic. So perhaps we might have a position on that topic that might assist you in your support or opposition. So now that you're ready to have that meeting, you're ready to introduce yourself. So what you want to do is make a brief introduction, where you're from, describe your job, your patients, etc. One thing you don't want to do is spend too much time on your introduction, because remember, you only have a 15 to 20-minute appointment time. So don't spend too much time on your introduction. Be brief but concise. If meeting as a member of ACP or the chapter, briefly share some mission and goals, but again, be pithy. Extend any possible thank yous for bill passage or support. Present the issue, be succinct, and use your own words. And try to remember, be confident, because you are the healthcare expert. Make the issues relatable. Provide real-life situations that demonstrate the problem. Use personal examples and stories that connect the topics to your constituents and your district. Make sure that you tell stories that they're going to remember, that will leave a story with them that relates to the problem or the issue that you're there to share with them. Be courteous, be polite, but be firm with your requests. While While most of the time the meetings are informal, remember, it's still a business meeting. You'll also want to listen to his or her perspective, but present your views. Try not to let the meeting get off track, because that does happen from time to time. Provide your leave behind materials at the end of the meeting if possible, because if you give them your leave behind materials at the beginning, they start going through the information, they're not paying attention to you, they get distracted, and that's not a good thing. And also, make your ask clear and be sure to say thank you, exchange business cards, and you can take a picture. Don't be afraid to take a picture. They love that, trust me. After the meeting, perhaps within 2 weeks of the meeting, send a quick thank you to recap the meeting, highlights that took place, any legislative commitments that were made, reiterate them in your thank you note. Don't be afraid to follow up with staff, because building a relationship with legislative staff members can also be equally important. Most staff prefer email, so you'll want to tie up any loose ends from the meeting, such as support for the bill, answers to any questions. Consider following up and scheduling any future meetings back in the district. So if you were in Albany or DC, depending upon whether it was a state meeting or a federal meeting, or even if you were meeting at the local district, doesn't hurt to schedule a follow-up meeting, perhaps on another topic, if there wasn't time to get all of your issues in for that one particular time. It's okay to schedule a follow-up for a future time. Here's some tips for effective advocacy. So again, you're the most valuable resource on health-related issues. Don't forget it and use it. Check in with New York ACP or ACP in advance on policies and/or positions. Leave behind materials should include extensive information to support the issue that you're there for and the ask that you're going to make. On subject matter, be accurate, brief, and/or don't forget to add something new. Again, a personal story goes a long way. You will enhance your effectiveness with a friendly exchange of ideas. Always remember, your own personal experience as a physician is your most effective advocacy tool, and stories are excellent to provide. If you're meeting as a group, include medical students and residents in these legislative meetings. From our experience, when we go into a room with a diversified group of physicians, for whatever reason, legislators will always migrate their attention to medical students and residents. So again, advanced briefing is important for the entire group. If there is agreement, get the legislator's commitment to take a specific action. If you don't know the answer to a question or additional information is requested, offer to obtain and follow up with that information. It's okay not to know the answer to a question, but do follow up with that information. If informed at the last minute that your meeting's going to take place with a legislative aide, graciously accept. Do not cancel that meeting, because in most cases, staff members are just as important, if not, they may know more about the bill or the issue than the legislator himself or herself. So good meetings can take place with their legislative staff. Here's some things that you absolutely want to avoid during a meeting. Leaving your Senate or Assembly member or staff guessing about what you're asking them should not take place. Therefore, going back to the importance of being specific with your ask, very, very important. Reading directly from your leave behind materials is not a good thing, or from your script. They have that in their leave behind packet. Again, you should brief in advance, so you should know the issue in advance. So don't read from your handouts. Don't read from your packet. Speak from what you know. Share your stories. You know them better than anything else. Being unprepared is not the best way to convey an issue or a topic in a legislative meeting. Again, being prepared is what you need to be. Mentioning financial support or campaign information is a big no-no. That should never take place. Directly quoting staff or the lawmaker on social media should not happen. Distractions during the meeting, such as checking your mobile device or texting, never should take place. Sending emails or constantly checking your phone should not happen. Looking or acting overly disappointed when you're getting pushback during your meeting, please don't let that happen. Should not take place. Some things you should remember. Similar to physicians, legislators are extremely busy. They're responsible for attending committee meetings, attending their Assembly and Senate sessions, voting on bills, meeting with constituents and other groups, reviewing constituent mail, press clips, various reports, meeting with their legislative staff to get updated on various bills, etc. So again, be mindful that they are busy individuals, just like everyone is these days. But during meetings, it's important to be brief, but to the point, know your issue, be clear on your ask. There are advocacy engagement opportunities. So during your meetings, if there is an opportunity, ask your elected official if they have a mailing list for healthcare issues. If so, ask them if they would add your name to that list. Volunteer to serve on a physician roundtable if that's available, or an advisory committee, or some other healthcare meeting that might be available. And I personally know that these opportunities do exist. We have had members of NYACP on physician roundtables get appointed to New York State advisory committees and work groups. So these things are reality. But if none of these exists when you're meeting or asking, don't be afraid. Suggest that one be initiated. It never hurts to ask. Also, consider scheduling periodic meetings with your local Assembly, Senate, and congressional representatives. Again, you're looking to build relationships, and the way to do that is to meet every now and again with them. Even just a check-in to see whether there's been any progress on a bill, or how you might be able to help move a bill along. Check-ins are always good. Invite them to a meeting that you're having, whether it be a chapter meeting, a regional meeting, a district meeting, a hospital meeting. If you're part of a large group practice and you're having a problem within the practice, invite them to a meeting within the group. It doesn't hurt to ask. Extend an invitation for an on-site visit to your office, hospital, or clinic. And that way it'll give you an opportunity to provide them with examples of day-to-day patient care delivery concerns, or expose them to practice-related problems that exist. And also, as mentioned previously, if possible, attend local town hall meetings, because that way you'll get to meet other people and you'll be able to talk to other people about concerns that you have, other ways that you might get involved locally that may be a good benefit, that will even get you engaged with other opportunities to meet other senators and assembly representatives and elected officials. So those were just, some considerations, but they are reality for a lot of members. And later in our presentation, you'll hear more about that. Now, let's focus a little bit on some other, what you can really do when opportunities come along from New York ACP and ACP. So this week, while some of our leaders were in Albany for Advocacy Day, focusing on 3 top priorities for the chapter, those 3 priorities were actually put together in a legislative member call to action. So I hope that our members took advantage of responding to that email that asked members to send a letter to their elected officials on these 3 top priorities that went out on Wednesday. They contained information, background on the issues, and it's quick and easy. We provided a draft letter, and if you wanted to personalize it, the opportunity exists. But if you were busy that day, you just simply click and send. And the chapter does this several times a year. So please pay attention and respond to these as they come into your inbox various times throughout the year. They're very, very effective and definitely helpful. So please respond. And if you ever have any questions, just contact the office. Similarly, the same types of requests happen through ACP National. They also have a call to action center as well. If you're interested in getting more information on federal legislation, we strongly encourage you to join AIM, the Advocates for Internal Medicine Network. It is free. You can go on to ACP's website, go click on the Advocacy tab, and just sign up. 1, 2, 3, simple, easy peasy. And that way you will receive an email periodically giving you highlights of what's happening at the federal level. And if there are any action items or action that needs to be taken on federal issues, you will receive that information and hopefully respond to it. And so I flew through my portion of today's webinar. I hope that you start thinking about questions, but hold them. I want to thank you for your attention. We do have 2 other special guests with us who will be sharing their personal stories on advocacy involvement. And you will definitely learn from their experiences. So I want to first turn it over to our vice chair of our HPP committee, Dr. Nandini Anandu, and then Nandini will then turn it over to Dr. Shane Solger for his presentation. So I'm going to stop sharing and turn it over to Nandini.
Hi, everyone. It's so nice to see so many people that are a lot more involved than I am with advocacy. Dr. Simon, Dr. Lee, Dr. Solger, Dr. Chait, everyone's pretty much involved. So yesterday we talked about how to become involved. And the very first step is to figure out who your legislators are. If you go to the advocacy page on the NYACP website, click on that, and there's a whole bunch of resources in the bottom. One of them will be to find out who your New York State Assembly member is, and the other one is who your New York State Senator is. So once you have that information, you want to go to their pages and figure out what committees they're on. It's helpful if they're on the Health Committee, the Insurance Committee, and the Ways and Means Committee. Those are probably the most important ones from our standpoint. I did this yesterday, but I don't need to do it now. I went through it and shared my screen, and I showed that when I put in my address, my assembly member is Amy Paulin, who happens to be chair of the health committee for the assembly side. So it's good to know who your people are. And the other thing that we talked about is if there is a particular bill that's important to you, to get to know that bill, but also to understand if national ACP has a policy stance on this. The example that I used yesterday was about the recently passed medical aid in dying. It passed in the Assembly. It's still waiting to be passed through the Senate. But there's a lot of momentum for it. So I showed people how to use the ACP Online website to be able to navigate to find the policy statements that we have. And I pulled up the policy, which was probably, I think, 2017 for this particular issue. And that policy states that ACP does not support this, which the terminology was physician-assisted suicide. So it's helpful to know what ACP's policy is, because anything we do has to be in alignment with national ACP. But yeah, just starting off to getting to know people, it really helps. I started by just becoming more active in my community through local nonprofits, attending their events, attending fundraisers. I became more involved with my local political party, and once again, attending fundraisers and events for that. And a lot of times the politicians will come, especially the local ones will come to these events. So that's been a nice way to sort of casually have them recognize your face and get to know you and see that you're not just a person coming once a year to Albany, that you're an active member in your community. So that kind of helps them also remember who you are. That's probably all I have to add at this time.
Thank you very, very much. Those are great and helpful hints and information for our members to find their legislators and get more involved. So thanks so much. And now we're going to transition over to Dr. Solger, who can share his presentation with us and jump right in. And following his presentation, the three of us can take any questions from the attendees. So Dr. Solger, take it away.
All right, perfect. I hope everybody can see my slides. But I'll just be talking briefly kind of about my how and my why regarding healthcare advocacy and residency and some of the things that I've done. So hopefully that helps guide your efforts. So this is just a brief outline of the lecture, just going through why I think you should advocate, how to advocate, and some concrete examples for resident advocacy. So I kind of understand why someone might have the question, why do I need to advocate or be an advocate in the first place? Aren't there just huge groups of people that already do this? Can't they do it instead? What if I just want to be a doctor and then work and go home? And to that, I would argue that we work in a unique profession. We took an oath, and this oath talks about how we should consider how the sick are intertwined within our society and how it can affect the well-being of other people and their family and the economy. There's also an argument to be made that we have an obligation to promote good public health policy as prevention of communicable disease is bigger than just a one-on-one interaction with a patient. And lastly, the oath reaffirms our role in society as individuals who have agreed to undertake this special obligation to help our fellow humans in our communities. And so, as professionals with this unique societal contract, one of the skills that we are developing is the ability to be effective storytellers. Every day, whether at the bedside, doing a history and physical, or in our clinics, we collect stories from patients and then we retell them to our attendings. The same thing is true when we advocate for our patients or our peers. In healthcare advocacy, we're telling the stories of our patients to legislators or newspapers to try to drive improvements in the care that we can deliver. And on the topic of trying to improve care, there's this concept of the aggregation of marginal gains, with the idea being that if we can put in just enough energy so that there's a 1% improvement, this can then lead to incremental and compounding improvements over time. However, the opposite is true, and a 1% decline will also start to accumulate into something much worse. And to this point, if you do nothing, others will continue to do something. And other doctors have advocated successfully for things that many of us would agree is objectively bad. So, how can you become an advocate for good? And there's several ways that you can contribute, either through the government or through our local organizations like ACP, many of which Loretta touched on. And I'll also speak briefly about how to use the internet for advocacy. So one of the benefits of our social contract is that people oftentimes want to hear what doctors think. So you can get involved with organizations that can help you engage with local elected officials. One way that I was able to speak to my elected officials directly about the issues that concerned me was to get engaged with my union and their political action committee. And through CIR, I was able to speak with our congressional leaders. This is State Senator Jabari Brisport and Assemblymember Sufran Forrest. This is Brooklyn Borough President Reynoso. And I'm just going to throw this here to show you how accessible they can be, because this is a bunch of photos of residents with city council members. We have Crystal Hudson, Chio Say, Sandy Nurse, and Rita Joseph, who is the city council member for my hospital. And it's important to remember that the politicians will listen to us, but we just have to be proactive and put ourselves in front of them. We already talked a little bit about using ACP and New York ACP for advocacy, but also the AMA acts as an avenue for you to have a platform for advocacy. So as an emergency medicine and internal medicine resident, I've participated in ACEP's advocacy conference for the last few years, but internists can also do it through the ACP Leadership Day, which Loretta also talked about. And these events usually involve a day of preparation with lectures to help you prepare to speak to the legislators, followed by the walk on Capitol Hill. With this year there was a lot of meetings with Republicans in Congress, and this is myself and other members that we walked around with Congressman Garbarino from Long Island. And we were able to speak with them regarding our concerns surrounding the cuts to Medicaid. Usually, as doctors, we're able to cut through partisan politics and deliver real patient stories about how the decisions that they make will affect their constituents. And at least following this week, the Republicans put off the vote surrounding the budget concerning Medicaid cuts. And so at least we were able to hopefully push it off a little bit, but unfortunately, they still unveiled a plan to kick 8.6 million Americans off of Medicaid. So clearly, there's still a lot of work regarding physician advocacy to be done to help our patients. One way to get involved with advocacy in New York State is to participate in the 4-week advocacy internship through New York ACP. I did this as a PGY3, and I really can't say enough good things about it. It did help provide insight into how health policy is crafted in our state. And as I'll mention a little bit later, it helped connect me with folks that ended up helping me with my own advocacy goals. So one way you can push your local groups, whichever you choose, into advocating for something you believe in is by submitting resolutions. And I think earlier this week there was a talk on resolutions. And so this allows medical groups like the AMA and ACP, who all have templates and points of contact to help you with resolutions, to craft these resolutions. The resolutions help guide the policies of the organization. And when things happen in our government, the compendium of policies allow the leadership of the organizations to act. This is just one example, but existing policy informed by prior resolutions allowed ACP to write an amicus brief to support reproductive health care in North Carolina. And ultimately, these resolutions will empower organizations to write statements, fund research, or file lawsuits. So another way to be an advocate is to email or use social media to try to connect with your local elected officials. This graph was from a survey from congressional offices, and short of visiting them in person, personalized emails actually held quite a bit of positive influence, and it came in third both with regards to having some positive influence and a lot of positive influence. So hypothetically, to use social media to advocate for not cutting Medicaid, it would be less effective to post something like this and much more effective for a larger group of people to post something like this, where you mention the representatives so that the member and their staff pay attention to the issue. And so one of the proudest accomplishments I've had during residency was surrounding language justice for my patients. So for some background information, a large number of the people my hospital serves do not speak English. Haitian Creole is the second most common language spoken at my hospital, and the only overnight interpretation services that we had was via telephone, and there were a lot of connectivity issues, so our calls were being dropped multiple times during each interaction. We didn't have any video services overnight, and we actually had better access for video interpretation services for languages like Vietnamese, even though less than 1% of our patients identify as Asian. So as a PGY2, I brought this issue up at a union leadership meeting, and everyone from the different subspecialties started to chime in regarding how it was affecting us throughout the hospital. And we approached our administrators with a list of anecdotes and complaints from most of the departments, and it didn't get us anywhere. The message that was heard over and over from the members of my hospital administration was that there was no money for it, and there was no plan to obtain money for it. So we opted to go over their heads. We met with members of the city council, and we told them that about the issues we were facing with our interpreters. They then sent letters to the CEO of the hospital, as well as the CEO of the New York City Public Hospital System. And this culminated in a televised budgetary meeting whereby the same city council members then spoke directly to the New York City Health and Hospital CEO and criticized the poor quality of the interpretation services. After he was confronted, he then committed publicly to expanding language access at my hospital. So now we have 24/7 video interpretation. They bought 60 additional language tablets for the entire hospital. And most importantly, they've currently hired 3 in-person interpreters, and the first one actually just started working this last April. And much of the work that I did to make this happen occurred during my time as an advocacy intern at New York ACP. And it was during this period that I was also able to explore the literature surrounding the importance of language justice, and I was able to write 2 blog posts on the topic. And the internship was also an important networking opportunity. So this is Eileen Barrett, who I heard tell a story about how her hospital in the Navajo Nation did not have Navajo interpreters, and she bore witness to the harm it caused patients. And after hospital administrators refused to fund adequate interpretation services, she reached out to her senators and her local congresswoman, Deb Haaland, and their staff called her hospital, and within 24 hours, she had in-person interpreters. Through New York ACP, the staff connected me with Dr. Barrett, and she was able to speak in greater detail about what she had done and provided a roadmap for me in terms of how to best affect change. Ultimately, New York ACP allowed me to present what we had been able to do for our patients in Kings County at their annual scientific assembly, and it won first place in my category, and ultimately led to a scholarship from New York ACP to attend the National ACP Scientific Assembly in Boston. And while I didn't win, it did afford me the chance to tell my story to a broader audience. So in summary, you can either be angry about something in isolation, or you can turn it into action, either by joining a physician advocacy group or writing resolutions to move our larger physician groups to lobby for change. You can send unique and personalized emails, mentions, or tweets at your representatives, because if enough people do it, they'll start to get wind of an issue. And lastly, remember you're a professional storyteller. Tell your patient stories to the media, to lawmakers, or to hospital administrators, because it's really the only way that we can improve care. And so this is my question slide, but I know Loretta has planned for all of us to kind of take questions at the same time. So I'm going to stop sharing.
Okay, well, I couldn't have said it better myself. That was a superb presentation. Shane, congratulations. I had notes to kind of recognize you as one of our superb advocacy interns. And this is really, one of the reasons why the chapter has continued the program. We feel very strongly about educating medical students and residents about the importance of advocacy. COVID, for all the bad that it did, it taught us a lot of alternate ways of doing things. And the positive that came out of COVID for the advocacy internship program is that it allowed us to do the program in a virtual format, meaning we now can accept more advocacy interns because we don't need to give them a desk and a computer. And so we are thrilled that we've increased the number of advocacy interns we now accept. And we're delighted to continue increasing that number. And we are proud of you, Shane, and the work that you've done on behalf of your profession, your patients, and the folks that you advocate for, and the tremendous successes that you've already accomplished in your career. So congratulations. And now I'm going to open the floor up for questions. And I see Susan Lee has her hand raised. Susan, the floor
Yeah,
is
I'm
yours.
sorry my video doesn't work, but I just want to say, Shane, that um, you actually crafted 2 resolutions during my governorship. But am I right? 2? I'm pretty sure it was 2.
Yeah, I wasn't
And
sure what happened to I done one about pregnancy, but I hadn't heard
yeah,
anything about it.
it's somewhere. But I just want to say, like, when we get a resolution from our advocacy interns or from membership, and we have the opportunity to present that at national, I wish you guys could be there, see the excitement of these resolutions and us um, testifying in front of all these governors and giving testimony about um, why people should vote for it. But I'm especially proud when I'm able to present a resolution that is written from our grassroots membership, but particularly our advocacy interns. So I just have to say your story is so inspirational, and you really took every opportunity um, of what the advocacy internship offered. And I expect that we're going to get more ideas and inspiration from you. So thank you for everything that you do. We appreciate you and we are amazed by you.
Well, thank you. I mean, you were all you the group made it accessible. I don't it allowed me to have a full 4 weeks to focus on the things that I thought were important for my community. So I stand upon the shoulders of the giants who crafted the program, and folks like Loretta and Amanda that like really made it accessible. So thank you.
Yeah, Loretta's mentorship is really remarkable. So I can't tell you, probably she has so many mentees that have gone on to do great things. And, we often are able to connect you with people, not just in our chapter, but people like Dr. Barrett, who help to advance and guide you in the right way. So amazing work. Thank you. Have to give you a shout out.
Absolutely. Other questions for Dr. Solger, Dr. Anandu?
I have a quick question. So when you make the appointments, like what timeline do you usually need to give to make an appointment? Is it within a week, a day, month? How soon do you need to make the appointments? I'm just thinking like locally if we wanted to do something.
Mm-hmm. I would suggest you probably start like with a month out. But sometimes you can get it within a 2-week period. Um, when we were making appointments, and Amanda, really did a great job, but yet struggled with appointments, but stuck with it because the budget really impacted a lot of the legislators' offices from committing to appointment times. But under normal circumstances, a 2-week period should get you an appointment. So if you put it in an email, send it in, someone will get back to you. But I would start with all of the information that I mentioned. And I would start also with giving them a date and a time that works for, that you prefer. And then if you need to adjust it, they'll come back to you. But the more information you can provide, the better.
Got it. Thank you.
You're welcome. Any other questions? You can just unmute and speak up if you want. No? Okay. Well, if there are any other questions that happen to cross your mind after we end today, I hope everyone knows how to reach us. So I want to thank Dr. Solger, I want to thank Dr. Anandu, and I want to thank Dr. Simon, Dr. Lee, and everyone for their participation this week during all of the events that took place. It was an extremely busy week. We had a productive week. It was amazing. And I want to thank everyone who took advantage of this week. And I hope you all stay involved, get more involved. And if the chapter can help in any way, we're here to do that for you. So
I'm sorry, I did have one. Sorry,
Of
this is
course.
Jen. I'm sorry, I was having trouble unmuting.
That's okay.
I actually, have gotten involved with like sort of a grassroots physician group here, and we've done some advocacy things. I was just wondering though, I I work in a hospital system where I think there is a lot of apathy. And I do you guys have any tips for involving coworkers or people around you that you think should care about these things, but it's hard to reach them, you know? Like I feel very isolated in my hospital system, so I've gone outside of it to do more. But I'm just curious because it's something that bothers me a lot when I'm at work. I'm like, you should care about this. We should all be caring about this together. I was just wondering if you have any tips to involve like others.
So, in my capacity as a CIR representative, I used to walk around my hospital and I would just ask people like what was bothering them. And that's actually how we got just using as an example, that's how we got the pregnancy resolution that I wrote. Was I found a resident who was like fairly angry about a particular issue surrounding like how the program had allowed her to like take time off and how we were like making pregnant residents work overnight. Um, and then I kind of like I like offered to work with her to try to change things, and I just found what people were angry about. Because I think that if you provide people with, you have to find angry people as like part of it. And so when you find angry people, you just have to convince them that they shouldn't be apathetic about it, because people definitely become apathetic and they're just like, well, nothing is ever going to change. But I think once you tell people that there are tools for change, then they're more likely to do something. And that's how, I took her anger and we turned it into a resolution that, again, I'm not really sure where it went through New York ACP and ACP, but it actually got picked up by the AMA, and they turned it into a resolution that turned into a research report that is now hopefully going to be accepted at the upcoming They have an annual meeting coming in June. And so, but I would do that for many different things. You know, I would just like walk around in my capacity as like their technical representative and find out what people were pissed about. If people don't want to do anything, there might be many different reasons. You know, they may have like newborns. They may, you know,
Hmm.
in this political climate, like I know that many of my co-residents are like IMGs, FMGs, and they're just afraid to speak up. But there are people that aren't. But sometimes you just have to like hunt them down. But I think part of what you did is also what I would suggest, which is like find an advocacy community. And,
Hmm.
you know, I think that if people see what you're doing, it may pull them from kind of like the outskirts of like, I'm not going to do anything into even like, you know, maybe they're willing to write an email, you know, but they may not be willing to like go to an event or maybe, but like maybe they'll get there, you know. And that's why I think that one of the things that Loretta brought up, which is like kind of the advocacy center, like I send those all the time, you know, like personalized, but I'll change it around to be like more personalized, but maybe you never know what somebody's going to be willing to do. But I think providing people with the resources is helpful. And just like, you know, it sounds like you're engaging your coworkers, but you know, just engage them frequently and ask them what's bothering them. And then, you know, if you offer them kind of like a pathway or like a solution, I was pleasantly surprised by how many people actually take you up on an offer to help, like make a change, if that's helpful.
Yeah,
Yeah, I think that is.
I think just, yeah, like Shane said, it's just what people's comfort level is and to find within, you know, maybe at work or just locally, right? Um, what people are want change, and maybe it's not anger, but it's they're passionate about it. And if you're passionate about something, then you know you really get involved, whatever
Mhm.
it is. But yeah, I would just keep plugging at it, you know. But there's nothing wrong with getting involved outside of your work environment. I work in a group where people are not so passionate about doing advocacy, but there are a couple of people that are. And so from there, we work with other people in our community. So it's like a local thing.
Yes, Shane, I'll look into the pregnancy resolution and let you know where where it is. And also, Dr. Heinen, Shane touched upon it and getting, you know, maybe a couple colleagues together on an issue that kind of is burning in their gut.
Mhm.
And getting together, finding that resolution, in writing the resolution information on our website and drafting something.
Mhm.
It does not have to be perfect. Follow the guidelines. And we have a resolutions task force that does review drafted resolutions. So again, it does not need to be perfect. The resolutions task force will help the author of the resolution fine tune it to get it in the shape it needs to be in order to be submitted to, say, ACP, for example. So don't worry about it needing to be perfect. We will help you get it to that point, but just get the points down, give some background, and that's called the whereases. And then the resolves is what action you want to see. Once you put those down, then we can kind of perfect it.
Yeah, and anecdotally, like it doesn't necessarily just have to be like resolutions are an example, you know, for like, but for like broader advocacy, like why don't you care about air quotes, like, you know, like Medicaid. I found that if you care about the things that actually like that bother people, even in the workplace, then it's much easier to convince them to get engaged with your advocacy.
Hmm.
Um,
Mhm. Mhm.
it's one of those things where like people is like they don't care what you know until they know that you care. Like if you say like, hey, like let me help you with this thing that bothers you, then when you're like trying to go do something completely unrelated, but you need support, then people are going to remember that you care about them, and they're more likely to kind of jump on board with the things that you'd like them to help with or to care about.
Got it. Thank you. Very good advice.
Dr. Heinen, if I could just add one more thing, I served as a residency advisory committee, and I think the hardest part is really just the initial step, like Dr. Solger was mentioning. So just kind of starting by saying, hey, what do you think of blank? And then trying to get people open up to might be the hardest part. But it's always nice when people do open up, and then you kind of end up finding something that unites everyone. And then it's a nice common uniting factor. So good luck with the process.
Thank you.
Okay. All right, so being respectful of everyone's time, again, I want to thank everyone for being here, participating in Advocacy Week. Couldn't do it without all of you. So on behalf of NYACP, thank you very much. Have a wonderful afternoon, a great weekend, and thank you all. Appreciate you all. Have a good day.